Good afternoon. Pat Zemer here with MagnaWave. Welcome to the afternoon edition, the PM edition of the MagnaWave office hours. We have the MagnaWave office hours on Tuesdays each week at 9 a.m. and 2 p.m. To answer questions that you may have about PEMF therapy, about MagnaWave, about our machines, about the therapy in general, about training, all the different things that you might be interested in that you maybe are wondering about, but you'd like to have somebody answer the questions. That's why I'm here. I like to be transparent. I want to answer any questions that you may have so that you get the proper information. There's a lot of stuff out there circulating. Sometimes the more companies you talk to, the more confusing it gets because everybody puts different spins on what's going on and how it's presented. So I'm here to answer the questions that you may have. I need to turn my phone off here so it doesn't become a problem. There we go. And to answer those questions. So again, if you have a question for me, please feel free to put it up, and I'd be happy to answer it about whatever it may be. Also, so I wanted to cover a couple of things. I did have a question this morning after our program because someone was talking about the palpation that you see when you treat a horse, how you move the coil over a horse, and you notice the palpation of the skin, the twitching of the muscle. We have the same thing in people when we put the coil on a person and you put it on their shoulder, and you'll have a little jumping in the shoulder, that type of thing. So I want to talk intensities a little bit when we talk high power, high intensity, low intensity. The primary difference between the high power machine and the low power machines is the strength of the signal and the speed of result. Now, when you get beyond that, then you get into a whole nother topic of discussion dealing with what's the best for healing, what's the best healing times, what's the best hertz, what's the best this, what's the best signal, all of which we can address, but we could have a whole program just based on that. But if you have specific questions to that, please throw them up there. And so, again, I wanted to talk about why we treat areas of the body with varying intensities from different directions. And I don't understand this, haven't understood it when people told me about it years ago. When we go to treat, if we can treat the body, if we're treating a shoulder, for example, and we're treating at this kind of speed, and then you're treating the shoulder and you're getting some movement, and then we want to come back and treat it at a much faster intensity. Why we do that? The number one reason we do that, and this was pretty much originally in the animal world, is we have cellular memory or we have muscle memory, and if you supply the same type of direction of signal or the same type of energy every day at the same intensity in the same fashion, after a while, your muscle fibers can get to a point that they maybe pass it off or they don't accept it, they just slough it off. And so we want to, the whole thing that we try to do is, for conversation's sake, we can say element of surprise. We want to approach this shoulder today from this intensity to at a lower intensity, or tomorrow approach it from a higher intensity. Then the next day we want to approach it from the side or from the back. And so by basically surprising the tissue, we want the tissue to always be saying, oh, look, there's new energy coming, and I'm going to use it to the best of my advantage, instead of saying, oh, well, I've got this same energy coming every day the same way, so I don't care. So that's, I can't explain how the cellular function works, but it's amazing to me, and the best way to talk about this, and I'm not trying to talk about horses for those of you who are not interested in horses, but it is a good way to talk about drawing a comparison to how this therapy works. If you're treating the neck of a horse, you've got the horse's head here, and you're coming down the neck of the horse, and you've got a sore spot, let's just say right here in the neck, or a spot of sensitivity. So if you come down and you treat this spot right here, and it's a reasonable, moderate type of setting, that signal is going all the way through that neck. But if you take the coil and put it on the other side of the neck, you don't see the movement or the sensitive area. That's because even though it's going all the way through, it's reacting over here where the sensitive area actually is. And so when you talk about the sensitivity delivered and how it shows, it's amazing to me. Why then does it impact that we go from different directions? Because we're on the neck. Now on the neck of a horse, you can come from below. You can come from down here, you can come from here, you can come from this side, you can come from the top. But on a person, or when you get to the when you've got just this shoulder, it's a little more difficult, although you can come front to back. On an animal like a horse where you have the hip, it's pretty hard to treat that hip from different directions, even though you can approach it with different intensities, which is kind of like approaching from different directions. So some studies have shown, when Dr. Dennis did the NASA study, he was able to show a increase in healing, a potentiality of nerve regeneration, and so the intensities varying has an effect on that. So the higher intensities that we produce, or the higher power that we produce, goes to very quickly reduce inflammation, thereby relieving pain, and then you can come back and set the intensity wherever you might like it or what's comfortable, and then promote the healing from that perspective. And so when we talk about that, that's why we do it. Primarily, the different intensities are to keep the tissue fresh with what it's receiving, so it can better understand what it's receiving. So that's the question there. I also wanted to talk a little bit about studies. I addressed this a little bit this morning, where people will be talking about various studies doing this and various studies doing that. The reality of it is there are very few studies today that have been done utilizing this kind of therapy in the United States. Now, the modality is approved. The PEMF modality is approved for incontinence in women, non-union bone fractures, just non-union bone fractures. It's approved for migraines. It's approved for autism. They call that device the TMS therapy. And there's a new device that they're using for glioblastoma, to where it's basically like a stocking, like a sock cap that they put over your head, and then they have PEMF things that are working to remove inflammation in the head and hopefully reduce tumors and just help the whole situation along. And so there are some other approved areas as well. So when something becomes FDA approved, it's FDA approved for the design, the name, the function that they're approving it for, very specific. So to talk about this modality, and then you'll see people say, well, it's FDA approved for this. Well, it may be, but the question comes down to, is there a machine? Now, that's a whole new question of its own when somebody says, well, I have this FDA-approved device, and it was approved for dental, and they're using it for muscles. And so there is a lot of that going on, to where items are used off-label. They may be approved for one function, but they're utilized in other functions and other applications. But as I said, the modality, the PEMF modality, the MagnaWave modality, as we call it, is approved for various areas for FDA approval. Our company, the factory, and our sister distributors, we have machines that are in the process of receiving, hopefully soon, FDA approval. We're doing a study on venous wounds, a study on bed sores, and a study on inflammation, arthritis of the elbow and hip, knee types of situations, to be able to use those studies when they're completed as part of the FDA process for our type of devices. And as we know it, we're one of the only companies today that is actively on this course to have our equipment be manufactured in a FDA-approved type of facility, safety approved, UL safety approved, which can then be converted into using it as part of the FDA situation, and actually having studies that have been performed utilizing our equipment, MagnaWave equipment. Here we go. Kimberly's here. Appreciate that. Glad to be here with you, Kimberly. So if you have a question, please put it up there. I was talking about studies. There are a lot of studies that have been done over the years. I should probably go back and talk a little bit about what happened. There were a lot of integrative types of medicines years and years ago, PEMF therapy being one, electrical stem therapy, many other types of what we would call physical application type of therapies that a long time ago, a lot of the medical schools or a lot of the boards decided we don't want these in our medicine studies. We want our studies to be about medicine only. So schools that offered classes in modalities like ours or other modalities took them off the curriculum or away from the curriculum. And so we basically saw a lot of these types of modalities in the United States go to the side, whereas in Europe and Canada and other parts of the world, these alternative methods have been accepted, applied to their medicine practices in order to help the health and wellness of folks. So with that done, a lot of the early use of these types of devices, and in our case, we were working strictly in the veterinary area of the world, in which does not require that you have studies or the FDA approval or things like that in order to use insurance and insurance and other ways to get the therapy accepted and used. And so it's all kind of come to a halt. But here in recent years, you've seen the increase of light therapy. You've seen the increase of laser therapy, the increase of sound therapy. All types of different modalities are now coming to the forefront, and people are retesting. People are doing new studies on these various therapies in order to get them. It's called integrative. A lot of doctors are now practicing what we call integrative veterinary, integrative medicine, in order to apply other alternative methods that are moving along into their practice. I had a veterinarian tell me last year, we conduct traditional medicine so we can use some of the alternative therapies to enhance the results that we're experiencing or receiving. And I would have to say that when I go back over my years and look at things, we've progressed from a stage back in 2007 of nobody knowing what was going on or how it would do to really an understood level today where people say, oh, I understand what that is. I don't know how I'm going to use it for what I'm doing, but I understand. I've heard about it. We're really reaching more of a momentum, if you will, and that's come from a lot of people utilizing the therapy and a lot of people learning and studying what it will do. It looks like we, how can Magna, have a question, help osteoarthritis? I saw a post about Magna waving to help with uric acid. Well, two different questions there, but when we talk about osteoarthritis, the pain associated with the arthritis is a result of inflammation. So if we can help relieve the pain, then that's going to help the overall symptom of what's going on. So when we have arthritic kind of conditions, if you have a buildup of calcium and it's irritating the nerves and the cartilage and the tendons and causing pain, if we can take care of that inflammation, we can relieve the pain. Is this type of therapy necessarily going to go in and chip away and remove the calcium buildup? No, it's not designed to do that. Now, I'm sure that there are ways that they can do sound waves and lasers and all different kinds of things to maybe go in and help deal with the calcium buildup, kind of like they do with kidney stones. I was talking with someone this morning talk about kidney stones, and there's ways that they can go in and burst the kidney stone to where then you can pass it easily and without pain. And I've had people ask me that question. I have kidney stones. Can I use your therapy on my kidney stones? If you have pain, absolutely, you can use this to relieve the pain of your kidney stone. This is going to massage the area. It could cause you to maybe move the kidney stone along quicker to potentially pass it, but then you need to deal with your doctor, because you're talking about a situation where the stone's larger than the area that it's trying to go through, and it's going to be very painful. I don't know that we want to do something that's going to make it more painful for you because you're trying to push this kidney stone someplace where it's not going to go. But that's what the various therapies can be used to do. But so when we look at can it be used to help my osteoarthritis, absolutely, because it's going to help relieve the inflammation, and then it's going to help the overall blood oxygenation of your body and blood flow to keep the area from becoming re-inflamed or painful as rapidly as it might without doing something to help with that inflammation. So yes, it will help in that regard. Now, when you talk about the buildup of uric acid, when people have gout based on acids and that type of situation, what we want to do is move this away, get the body to handle this excess fluid that it doesn't need to the lymphatic system or to ways for the body to dispel it, all of which I don't totally understand, don't really, to how to facilitate everything. But if we can help with the inflammation that's caused by these outside supplements or outside sources or forces to the body, then we can help the overall situation with your arthritis. It's an excellent device for dealing with arthritic types of conditions. When you talk about diseases like RA, rheumatoid arthritis, to where often it's here today, down here tomorrow, over here in 2 days, you got to basically try to improve the overall position of the whole body, allow the body to be well oxygenated with good healthy blood, help the blood be more normalized. You want to have good blood flow through the body, then let that good blood flow and oxygenation do its job. Let it work to defend the body and to support what you're trying to do to make the body healthier. So I hope that answers your question. Do we treat osteoarthritis specifically? No, we typically don't talk about treating conditions. We're about helping the body to be set up so it can better heal itself. That's, can we go to a particular area? I mean, it's conceivable that you can lay on a coil or lay on a magnetic surface, or not a magnetic surface, but a PEMF surface of some sort, and overall help the body. The question becomes the speed to which you're going to help the body be in a better position. And the higher voltage or the higher powered machines do this a little quicker than some of the lower powered machines. But you could basically lay on a mat and treat your torso, and will that affect your shoulder or your elbow or your wrist over time? Absolutely. But what we would do in a case like that is we would treat your elbow or your wrist or your shoulder, and then we treat the whole body to supply energy to the body to help the overall blood system be healthier on its own, to where it's also going to support that elbow or whatever the situation may be over time as well. So that's how we apply this. And so that can apply, well, I was going to say in rheumatoid arthritis, what we often do is go to where you're experiencing the pain, treat that area to help it immediately feel better. The dog just came in, to feel better. And then we treat the whole body. So over the next 10, 16, we found, studies have shown, and Dr. Dennis has pointed out in some of his recent articles, that you can change the blood flow on an organism and it can last for months. The improved blood flow, the improved oxygenation, if you're not doing something to deter that. I mean, you know, if you wash your car and keep it in the garage, it stays clean. If you wash your car and put it outside, it's going to get dirty again. And so you have that type of thing, depending whatever you're doing, to deteriorate or to cause your blood to become not as healthy as it could be. So you want to make sure, and that's another question that quite often comes up from folks, and that is, okay, well, if I'm treating, how often do I need to treat to keep the health aspect here, or that type of thing, and it varies from person to person, varies from whatever you're dealing with from person to person, or whatever the indication might be. Do I need a separate MagnaWave machines to treat myself and my dog, or is there a special machine just for pets? No, great question. Really appreciate that question, and that's coming in. The machines are very versatile in that you have a machine that you're using on yourself for your osteoarthritis or for your arthritic condition. You can use that same machine on your pets. There's nothing magical about the energy that we're putting into the body. Basically, what we're doing is creating energy to go into the body to improve the oxygenation, to improve the cellular health, to improve the blood flow, to allow the body to better heal itself. There's nothing different. Blood is blood. Organs are organs, cells are cells, muscle is muscle, and that's very similar across the board from people to animals, and basically mammals. And that's one of the ways we treat some of or we teach some of our anatomy is from a mammalian perspective, so people can understand the muscle structure and the oxygenation and so forth between all mammals. And so that's how it works. So no, you do not need a specific machine to treat dogs, or you do not need a specific machine to treat people. Now, there are some machines that are built up that are more suitable for traveling to the barns and being in those types of conditions around large animals, or where it's bulls, cows, horses, whatever it may be. Then there are other machines that are more suitable to be used at home, Are they the same? Yes. Do they? Some of them have different power levels, but basically the field that we're putting out, the energy that we're producing is absorbed and accepted by the cellular context of the body, and cellular exercise, cellular health, allowing the body to better oxygenate and heal. You've heard me say that, and I say it a lot because that's how the basic system works and how the technology is applied. So let's see, any other questions that we have here? Nothing at this point. We had a very good session this morning, and I don't want to go back and rehash that because there might be some people that are here. You can watch those earlier sessions if you would like to do that to learn about the various aspects that we've discussed. So if you have any questions, please put them up there. Again, the question can deal with education, the specific machines, specific applications, how the machines might be applied, how this is a great area, how is this complementary. A lot of people would come back and say, well, I use this kind of therapy. Will this be beneficial if I use a laser or if I use some other type of physical therapy or physical therapy device? I believe that a lot of these different devices are very complementary to each other. So to use, and it's kind of like building blocks. You're kind of building blocks of health. And so if this will work great, and at this type of level, and then we add this for what it's magic that it works, and then we add this, and you put the 3 or 4 of them together, you can have a very complementary aspect to what you're doing. We do this in medicine when you take 3 or 4 different pills to handle 3 or 4 indications, yet sometimes they're complementary to each other. Other times they work totally separately within the body and they go in. But complementary procedures, as far as I can tell, are very good and work very well. So would I say that someone only needs to have a MagnaWave? Well, no. There are a lot of people that have a MagnaWave that use in their practice and they don't have other devices, as I'm sure there are people that have light therapy and other things that they don't move back and forth. But if you're doing respiration, if you're doing a nebulizer to get good, to get some medication into the lungs or into the throat to be better absorbed through the lungs, and then you use something like MagnaWave to enhance that whole situation and the fluidity of the body, then to do the two things together is very beneficial in my mind as to how things can be used complementary together. And certainly I did laser therapy for a number of years, and along with magnetic therapy. Then I got into the high-powered magnetic therapy, still use laser from time to time. We're now using nebulizers to help get good medication into the lungs or to get good oxygenated molecules into the body to fight various indications and do things. So a lot of things, as I say, are very complementary. So any other questions that you may have, I'd be happy to answer those questions for you, so you're perfectly clear on what's going on. The difference here is I keep talking because I don't want you to just sit here and watch me sitting in a chair like someone may do in an office. They can go do other work waiting for someone to answer a question. And I suppose I could do that and go ahead and do some other stuff, but I don't want to do that. I want these to be nice and succinct so people can have their questions that they're looking to have answered taken care of. So we've been going for about 30 minutes now. We had 2 little segments. Somehow we lost our signal. So I'll hang for another minute or so. If you have a question, please feel free to throw it out there. And it doesn't make any difference what it is. I'd be happy to answer it. People have asked me, this is a good question. We have talked about, we have some supplements that we have on the website. We have Lubricin, which is a joint supplement. We now have the C60 supplement, which is for overall cellular regeneration, body regeneration, the C60. I'll tell you my story with the C60. That'll take a second while we're waiting to see if anybody else has a question. The C60 was basically an industrial lubricant. And so they wanted to do a study on the C60 to see if the people utilizing this material on their hands and breathing it, and so on and so forth, if it would be dangerous to them, as with chemicals that we use. So they took these rats and mice, and they started giving them this particular product to see how much they would have to give them for them to die. And then they would make a comparison to how much a person could be exposed to before they got ill or before they started having adverse reactions and that type of thing. And what they found through the studies is, so they're giving these mice this product, and they go, okay, let's go and do this for 2 weeks and see what happens. And they did it for 2 weeks, and they looked at them and say, well, they're not dying. Well, actually, they seem to be a little healthier. So that's all right. Let's up the dosage. We're going to get it to a point that it takes control and will basically kill these mice. And so that's what they did, and the mice were not dying. And they kept looking at them and saying, well, they just seem healthier. They seem younger. They're doing stuff that they weren't doing before. And they had a controlled study. They were doing these and they weren't doing these, blind type of study. And so then they kept going. And they were getting to levels that were exorbitant, and they were thinking, surely this is going to react in these animals. And so they had to kill the animals in some fashion so they could then do autopsies and see what's going on. And they found that, my goodness, they're healthier. They're doing better. And so and then they got to refining it and making it so that it could be taken by people as a supplement. And so now it's on the market today. It's available as a supplement. We have it on the website. But here's my story. So I was introduced to this product, C60, in June, late June, and I began taking it. You do a dropper full. It's in a little bottle, I don't know what it is, ounce bottle, and you do 3 dropper fulls. Just put it under your tongue, take a swig of water, and wash it down. To me, that's more comfortable than just putting the olive oil type base, and swallowing it, because the olive oil kind of burns, or just I can just taste it. So, but at any rate, so I started taking this in June, late June. And I went for a physical. I do basically 2 physicals a year. I do a summer, to where it's just a quick thing, checking blood and all that kind of stuff. And then I do my full physical in October or early November. So I started this, and I went to my doctor in July, and she took blood and analyzed everything, and it was typical. Well, your A1C is high, and so you're almost on the borderline of diabetic. Your cholesterol is not where it needs to be. This is different, and this you need to watch this over here. And so there was my blood type of situation. Okay, so I've been taking it, and within a couple of weeks, nothing had really changed. They want to wait till you reach saturation or homeostasis, is what they talk about with this product. So I went back for my physical a week ago, my annual physical. I gave blood on Friday, went back to the office on Monday, go through everything, and my doctor's sitting there going through my blood results, and she kind of looks at me and she says, everything is better with your blood. Everything is better, which has not normally been the case. Now, they didn't do the A1C for some reason, so I'm going to go back and have the lab do an A1C on your blood. They keep it for a period of time so they can still do that test, which is for diabetes and so forth. And I said, okay. And she said, but I don't understand why it's so much better this time than it was in July. I didn't say anything at this point. I just, okay. I mean, she knows that we do therapies and magnetic therapy and all this kind of stuff. Then she called me 2 or 3 days later and said, I got your A1C back, and it's better than it's been. You're well within the guidelines. So, I don't have you as a pre-diabetic type of thing, but you need, certainly at my age, you need to watch so you don't become diabetic or strong diabetic type of situation. And I was amazed that in the period of, July, August, September, October, 4.5 months, that my blood work changed dramatically. And the only thing I really did was to take this C60 in addition to using my therapy daily. I do my therapy all the time. I've had some prostate issues, so I do my therapy every day to keep my prostate in control and everything healthy as I possibly can. But that's really the only thing I changed. We'll diet. We'll do wheat for a while, and then we'll try various diets because we want to be healthy and lose weight as we can, and so on and so forth. But we've done that in the past, and it's never impacted anything that we're doing from the blood position. But this time, first time, better blood control. Everything was improved. So we have these products, and I'm not trying to sell you a product, but I'm simply saying how this supplementation worked very well from the standpoint of being a compatible or a complementary type of thing. That's why we offer these things. The HydroWave water is there to keep good oxygenation in the blood to fight bacteria. Now, has it been used for various conditions? Yes, it has. And people can talk about that. There have been some studies, there have been some things done testing how it works on on various indications and conditions. But so we have these things because we go to conferences. I know that what they're doing in Mexico, utilizing our equipment, and some of these supplements are what they're doing in Europe, the things that they employ. We try to have anything that we can that where people may be leaving the country or going other places to try on their own that are legal, that are supplements, that we just, we know they're supplements. They're not meant to diagnose or treat anything. They're just supplements, and we try to, if people want to have this at their disposal, they can. And we're looking at the Ananda products for health and inflammation reduction, a lot of different situations like that. So that's the thing. Let's see. We have a question here. If there's an older person wanting to be treated for back pain but hasn't been to a doctor to be cleared for the PEMF treatment, should we still treat the client or urge them to see a doctor first? Well, that's a very good question. The short answer is they should see a doctor. Because we want to make sure that someone is capable of receiving any type of session that you might provide to them. But you need to sit back and talk to the person. There is a checklist that we go through. Do you have a pacemaker? Do you have this problem? Have you had that problem? That we try to narrow down and see what there could be, if there is something they have or that they've had that could impact what they're going to receive. And so go through that checklist. It's available on the website, and just make sure that they are in good shape, that they haven't had some issues, or that they are telling you that they have an implant for this or that, and approach it from that perspective. Do people who have had indications and thereby have a treatment, do they have success? Sure. There's people that do a lot of things. This person could go online or go to GNC and buy a supplement for their energy and take it and be just fine. On the other hand, they could go to some place and buy something and take it and not do, all of a sudden be feeling a little ill, and then they need to go see their doctor. To treat someone, to have a session with someone who's got low back pain and you want to treat their back for 6 or 8 minutes, put it on a very moderate setting, treat their back for 6 to 8 minutes, see how they feel. They're going to stand up, they're going to feel looser, they're going to have their pain have improved from a 10 to a 7 or a 10 to a 5, with 10 being high pain. And then you're going to, okay, that's fine. And then do it a second time. If you treat somebody 2 or 3 times, we're not doing anything but providing energy to the body. We're not putting anything into the body that's dangerous. We're not putting, it's a off-the-shelf, class 1, non-invasive, energy-producing device. Just like you can go to Walgreens and buy heat devices to put on your back, and what they're doing is working for blood flow and circulation. So that's all we're really doing. We're providing a mechanical process to the body to supply energy to the body, so the body can be hopefully in a situation to better take care of itself. With that said, if someone hasn't, you need to encourage this person to go see a doctor. You need to go once in a while, because you don't want to have something going on that you're not paying any attention to, and then all of a sudden it's there, and now it's a serious problem. And we have a tendency to do that. We have a tendency to sit back and say, I'm okay, I'm not going to treat myself, I'm not going to do this. I'm my own worst customer. I have this stuff, my back, I don't have back issues, I really don't have any. I'm getting some little arthritis here in my thumb, so I treat my wrists, and it's better when I do that. But I didn't use my equipment personally on a regular basis for years because I didn't feel bad. Hurt my knee one time, and I was out moaning and crying about my knee, and a woman looked at me and says, "Do you treat your knee?" And I said, I ought to treat my knee. And I did, and it was better. 68 years old. All of my family has had prostate issues and surgeries and problems, and I didn't treat myself regularly. All of a sudden, a year ago, I have an issue. Who wants to do a biopsy? They don't like what they see. I'm on the water like crazy. I'm treating myself every day. Do biopsies. You're okay. Whatever was there is dead and benign. And like religion, since that point in time, I've been treating myself. And now I'm using my C60. I'm a believer in ozone therapy to help the oxygenation of the body be supplemented so it can better attack and take care of whatever's in my body. So I use a lot of things complementary to what I need for my health. And as well as, but I would say my mainstay is MagnaWave PEMF, MagnaWaving myself every day. But those are questions that people have asked and wonder why we have various supplements and how we approach them. I mean, ozone is something that I've exhibited at an ozone conference, learned what ozone did, learned how they utilize the ozone for health. They use ozone in dentistry to kill cavities. They use ozone to help seal off and wounds to what it can do there. They use ozone. You can have ozone. It's called insufflation. You can put ozone into your ears to where it's created through a little machine and goes into your ears. You can run it through an olive oil type of mixture and breathe it. Ozone, you don't want to breathe high concentrations without some type of protection because it is a poison of such, and it will not be comfortable. You will choke, and so that you don't want to do that. But you can do it through the ears. You can do it you can breathe it basically. You can it can be applied what they call rectal insufflation, where it's like a little enema type of thing, or a woman can do it vaginally to apply the ozone. The lower level of her body, or the lower area, the tissues there are very receptive to easily absorbing the properties that are given to them. So to use it rectally or to use it vaginally is a very good way to bring that into the system. And I learned through these conferences that I went to that what they would do is the doctors that use the complementary PEMF with their ozone is they would use this on pets or people. So they would apply the ozone into the body, then they would put the PEMF over the abdomen and massage the abdomen to get this to help move it out of the abdomen, out of the intestinal area into the body. So they used it very complementary to do that. I was just so impressed with that when I saw that, and I learned and heard about the results that they were having systemically utilizing the ozone therapy in conjunction with MagnaWave and getting some very good results that people were looking for. So anyway, that's why we have complementary products on our websites. We want to present to folks many different varieties that they may have to help them accomplish or do what they need to do to keep themselves healthy. We're a PEMF company. We believe in PEMF. We've dedicated our careers and our life to the modality of pulse electromagnetic field therapy and what it can do. Am I going to sit here and tell you that something's an end all? I don't do that. I'm as transparent as I can be to tell you what's good, where their questions are, how it will apply to various and sundry issues. You know, people will say, can I use this for this? Well, every person is different. Every condition is different. Every indication, how it affects one person as compared to another person. So when we started, it was all about athletic performance. Help my horse run faster. Help my horse jump higher. Help my horse have better range of motion so it's more fluid when it does what I'm asking it to do. That's everything we did. Then we started getting into, well, wait a minute, after I've done all this, I can help myself recover. We've taken to walking, so we're walking. We try to go for a nice brisk walk every afternoon. Well, I exercise some, but I don't exercise a lot. So I kind of had Saturday, I kind of had my Achilles tendon on my left foot bothering me. We went to a soccer match that evening and watched Louisville Club soccer, which was excellent. They won the Eastern Division in their soccer league, and Louisville City FC is looking to get into the MLS, and they use our equipment daily on their players for hamstrings, for back issues, knees, whatever it may be. So we really are happy to have them as customers, and so it's exciting to go to the game and watch them perform well and do all that. But anyway, I was telling you about my Achilles heel. So my tendon was bothering me. I went home Saturday night and I treated myself 15 minutes using the paddle with with a Max machine that I have at home. Immediately, the flexibility was better, the pain was relieved, but it was still there. I could tell walking around. But the next morning, Sunday morning, it was much, much better, and I was very pleased that I went home and did that instead of going home and thinking, well, I'll do it tomorrow. And when I think I'm going to do it tomorrow is when I forget about it and don't do it for 2 or 3 days. Now it's aggravating me enough that I've got to deal with the inflammation first before I go on. So I get to rambling and I'll talk because I start thinking of things. This is something that we need to discuss, or we need to talk about that. So we've been here 46 minutes. So any questions that you may have with regard to the supplements that we have, how we use them in conjunction with MagnaWave, or how things can be complementary to each other, we think that's very important on how things are. You might call it integrative. We like to be integrative in our approach so things can work together. A lot of the integrative doctors. I had a conference, and as a matter of fact, Thursday, during my webinar period, last Thursday, I did a webinar with Dr. Gary Nye, and we talked about, we addressed a specific dog client of his, a specific horse client of his, and we talked about essential oils and how he incorporates essential oils into his practice. Dr. Gary is in Missouri, and he is an integrative, holistic practitioner, and his wife runs as part, they have basically 2 separate practices, and his wife is a conventional veterinarian, and they will pass clients back and forth. If there's somebody that she feels needs what Dr. Nye does, then she'll have them do that, and he'll do the same thing. But so again, it's very complementary, although he's kind of focused on the integrative methods of what he's doing in his practice. And we'll be talking about that, what I'm going to do. The webinar was on a private server, so it was available to those that signed up. But Thursday, 2 o'clock, I'm going to replay that webinar during our webinar time period so you can see and hear exactly what he's talking about when it comes to how he has implemented MagnaWaving into his practice, and how he then uses the complementary modalities of acupuncture and essential oils and chiropractic as very complementary methods with his practice, and then how that works and plays with his wife's practice and other people that he works with around their area. So tune in for that. Thursday at 2 o'clock, I'll be doing a replay of my webinar with Dr. Gary Nye. I think you may find it very interesting. Very interesting from the standpoint whether you're looking at MagnaWave for your personal use as a person or for your small animal. It all works like the one question we had today. Do I need to have a specific device for me and then a specific device for my dog or cat or horse? No. And so the way he's describing it, you can learn so much from how he will talk about this and the implementation from the device to the chiropractic to the acupuncture to the essential oils, and how and he also talks about nutrition. It doesn't do you any good to use a MagnaWave if you're not doing something with your nutrition to make sure that your body is not in a proper toxic state, to make sure that you don't have the proper nutrients in your body that you need to be healthy. And so it all plays hand in hand, and he does an excellent job of describing how he works all of that together as he goes. So Thursday, 2 o'clock. Appreciate you all being here with me today. It's been a great time, and I just always appreciate you being here. It helps me learn. It helps us help you to learn more so you can live a healthy, happy life. So again, thanks for being with me, and I'll talk to you on next Tuesday on office hours, but we'll be here on Thursday with the MagnaWave Wellness webinar with Dr. Gary Nye. Have a great day. Bye.